Hey there, North Carolina Orthopedic Association members. This is Connie Wilson, your lobbyist at the General Assembly, and I wanted to introduce today a special guest we have, Dr. Claude Jarrett from Wilmington. He has kindly agreed to be on this program. And just to give you a little background about him, he's one of the top-ranked healthcare providers nationwide in patient satisfaction. He has a busy clinical practice and participates in grant-funded research programs. He went to Vicksburg High School. He attended Xavier, and he graduated from Emory. I think, now, are any of those schools, Dr. Jarrett, good at football or basketball? I mean, what's important here? It sounds like you went to some pretty good schools there.
That's right. That's right. Not so big in athletics, but really strong academically.
That's right. So he did extremely well, had an orthopedic residency at Allegheny General Hospital in Pittsburgh. He's now practicing in Wilmington at Wilmington Health. He has a wife and 3 beautiful daughters. So I know he's extremely busy because I know what it's like to have daughters. They can keep you very busy, but we want to welcome him to the show today. And is there anything about the intro that I may have missed about you that you would like people to know about you, Dr. Jarrett?
Oh, no, the small corrections, kind of, actually, I did medical school at Northwestern University in Chicago, residency at Emory Hospital in Atlanta, and I did my hand and upper extremity fellowship in Pittsburgh.
Okay,
so just
wonderful.
A small clarification.
Thank you for getting it right. And so moving on here, we had a very busy week last week at the General Assembly regarding healthcare policy. The Senate has a bill. It's House Bill 149, expanding access to health care. And it has many controversial issues, and the lead-off issue with that bill is Medicaid expansion. And I know, Dr. Jarrett, this is an issue that's near and dear to your heart, Medicaid expansion. Tell us a little bit about what you've seen in other states with Medicaid expansion, why it's important, and how it impacts orthopedics.
Yeah, Connie, thank you. Again, thank you so much for inviting me. This is such a good podcast, and I think it's something we all look forward to hearing and participating in. Well, I think first and foremost, we can all agree that improving access to healthcare is important, right? Doing so through Medicaid expansion is, one of the options that many think probably a little bit long overdue, but does have the potential of benefit of improving health equity in our state. But the current discussion that we're having should only be considered the beginning. We need to emphasize that the limitations of simply expanding Medicaid without timely access to subspecialty care such as orthopedics is actually potentially falling short on its real goal. There have been many studies, actually some of which are done here in North Carolina, that have revealed that simply expanding Medicaid alone has been unsuccessful in improving much needed care to orthopedics and actually results in inferior outcomes. So I definitely think that Medicaid expansion has the potential for doing so many good things, but this current discussion should only be the beginning.
What now? You've practiced in other states? Have those states had Medicaid expansion, and how did it work? Those states work with orthopedics and outcomes for patients.
Yeah, so I have practiced such as in Georgia and as well as in fellowship in Pittsburgh and Pennsylvania, and we found a couple of things. One is that the states that have expanded Medicaid really have not been found to be significant improvement in access or improvement in quality for patients with Medicaid. That's the first foremost. So when studies that have compared expansion states and non-expansion states, the access remains limited, and that's the tough part. Is that in orthopedics, we know fairly well that patients with Medicaid, they often present with more advanced and more complex orthopedic pathology. And unfortunately, by the time they present to our office, they actually present in a delayed fashion. So we're seeing them with more complicated disease processes a lot further along in the disease time frame. And that makes it so much more difficult to successfully treat these patients. But we actually also find that that their social determinants of health, SDH, adds an extra level of complexity of caring for these patients. All these things together really make it difficult for patients to have the kind of care with Medicaid that they rightfully deserve.
So what you're saying, it's a good thing that the General Assembly is having this Medicaid expansion discussion, and that hopefully they do pass a bill, but that's just the beginning of the process. And that we as orthopedics need to stay on top of it and make sure that this whole care, especially for orthopedics, is included in whatever comes down the road with additional legislation.
Oh, without a doubt. Improving access to Medicaid is very important, very potentially successful, but it's only the beginning. This more legislation needs to be done to make sure that specialty care such as orthopedics is weighted appropriately for the patient's needs and the complexity of their disease process.
Well, that sounds wonderful. Well, one of the other sections of this bill is a major rewrite of the Certificate of Need general statutes. And what the bill does, and I'm just going to kind of ramble here for a few seconds, it does away with the CON requirement for ASCs, MRIs, some mental health type, behavioral health type facilities, psych beds. It changes needs assessment for many of the services. Some of the existing services that are covered by CON stay the same, such as nursing homes, hospice, those type of categories. But there's a lot of changes that are really a good beginning. And obviously there are some people who stakeholder groups that support Medicaid expansion but have concerns with the CON section. I know you're in a private practice. Tell us what the CON laws here in North Carolina, how they've impacted your practice, and what these type of changes would mean for your patients in your practice.
Yeah, great question, Connie. So I definitely think that CON reform probably needs to go hand in hand with Medicaid expansion. Often we are grappling with limited access to operating room, particularly in orthopedics. And for our Medicaid patients, being able to have control of site of service and timely surgical intervention is particularly important. They're already presenting late to our office with their trauma, their fracture, their orthopedic disease process. And if we can't really have control of site of service, that's even going to delay their care even further. So CON reform definitely needs to go hand in hand with Medicaid expansion.
Yeah. Well, that's wonderful. Now, I would be amiss not to mention that some of the other sections of the bill include a bill called the SAVE Act, which is allowing advanced practice nurses to practice without a physician oversight, which is a big deal. And I know our group has signed off in the past not supporting that concept. So this bill has been kind of packaged in the way. There's something in there that everybody likes, and there's something in there that everybody hates. It also has a telehealth section. And while we're wrapping up, I'd also like to ask you, Dr. Jarrett, what's it been like for your practice and orthopedic surgeons there with stress levels, workload, and how do you guys deal with it? Because ever since COVID started, it's been totally different. And it's been extremely difficult. So tell us what you do.
Yeah, yes, that's a very good point, Connie. Mental health is significantly a concern, particularly amongst orthopedic surgeons. We all struggle to find that good work-life balance. Orthopedics, we're known for working hard, putting our head down, working long days, putting our patients first, and often we have a difficult time finding a good work-life balance. So, what I try to do, which was recommended to me by one of my mentors, is make sure that I find quality family time. My wife and my kids are significantly important and helpful to help me find that balance, to remind me what's really important. So on a regular basis, I try to make sure every day to find some quality time to spend with my kids and my wife. Also, staying healthy. Exercising, finding time to stay fit, work out, lift weights. I enjoy running, swimming, and biking, and living here in Wilmington, it does help make those activities a little bit easier to do.
You probably can do that. You do that running on the beach, don't you?
It is pretty fortunate. But certainly finding time to stay fit and exercise is a great stress reliever. But I think we all have a difficult time finding a good work-life balance, and it's a work in progress.
It is. It's difficult. Keep reading in the paper, crazy things going on out there. Well, we appreciate your time today, and look forward to maybe in another year, once this bill gets passed, we'll have another visit on the podcast and talk about all the specifics in the next bill that we need to be working on for Medicaid expansion. Well, we appreciate everybody listening to the podcast for this month, and we'll be working on another one next month. Thank you very much. Bye.
Thank you for having me, Connie.